Hi, we are here today and excited to speak with you about AeroCare's partnership with Encore. My name is Amanda Phillips. I am an RN and the Business Development Manager for AeroCare. AeroCare's mission is to ensure the quality and integrity in the delivery of care and the service to our valued customers. We provide sleep products, nebulizer medications, oxygen therapy, and non-invasive and invasive ventilator therapy. AeroCare partnered with Encore's Nexus program over 2 years ago in Knoxville, Tennessee. They now have over 400 ventilator patients in the Encore Nexus program. So, what does this mean for you and your patients? Please let me introduce you to Zach Gantt, the CEO of Encore Healthcare, to learn more.
Great. Thank you, Amanda.
You're welcome.
So today we're going to be walking you through a presentation of what it means for your patients to be in the Encore Nexus program and to be managed by AeroCare. So we're going to switch over some slides and really show you what that looks like, what the software does, and how that relates to how we can better care for your patients. So what we're really talking about today is home ventilation, right? So all your patients that you refer to AeroCare who require ventilation are going to be automatically enrolled into the Nexus program. And so I want to tell you what that looks like. It's a disease management outcome-based program, which means that when you write the order for the equipment, you don't have to do anything special. They're automatically going to be enrolled in the program, and we're going to start this process that we're about to walk you through. What that looks like is there's an individualized plan of care created for the patient by the software, and then we follow that plan of care to be able to manage the patient's outcomes. Everything that we're doing is focused on how do we educate the patient and create this self-management process, which means that we're teaching the patient how to self-manage their own care, how to recognize emergencies, how to react when they start to have symptoms. So it's really about teaching them how to manage their care in the home so they're not ending up back in the hospital. And then throughout this process, outcomes are tracked in the software, and we can report those back to you as much or as little as you want. Traditionally in DME, you see companies that really are focused on the equipment, and so we also are focused on the equipment. But what we added to our service through this partnership and through Nexus is really the patient care part. How do we be holistic in how we're managing patients? And it's so much more than just assessments, but it's managing a plan of care, managing a process, having a systematic process where we're solving problems for patients that cause them to go back to the hospital, and then being able to report that data back to you.
Because Knoxville was so successful with this program, AeroCare has launched the program across several regions. All of the RTs have been trained on Nexus and have the opportunity to provide pulmonary rehab for non-invasive, invasive, peds, and adults. With Nexus, not only can the RT provide in-home care, but they can also be their advocate, speaking with their doctors on how they can best improve their quality of life and manage their disease process. RTs can screen patients for comorbidities and push them back to the office for follow-ups as needed. Nexus is driven by respiratory protocols. The clinical focus is working with the patient and the equipment together. Patient engagement is challenging with this patient population, which is why Nexus uses competency badges. This helps the patient become more involved in their disease process along with the RT working together to find out what is important to the patient.
All this is so we can close the loop of communication between your patients in their homes. We know that in the home they don't have respiratory care normally. They don't have somebody that's advocating for their care, and so we want to be that advocate. We want to be able to support what you're doing in the office and continue that into the home, create a continuum of care out of the hospital and out of your practice into the home with the patient. We can do that with various different forms. We can see patients live, which we talked about a little bit. We can also do telemedicine visits, and we have some automation that we can use, like automated phone calls, to be able to do assessments and manage your patients remotely.
So in order for the RT to build these relationships, we have developed the Nexus schedule. The RT needs to be in the home, establishing a relationship and building trust. We can do this by seeing the patient more often in the initial setup. So we have several assessments that we do over the course of the first month. The RT will see the patient at the initial setup, then every week for the next 4 weeks, continuing to build that relationship and solve any problems that may arise. After the first 4 weeks, the RT is then in the patient's home on a monthly basis. Of course, if the patient needs more interaction or has any issues or questions, the RT will be scheduled to see that patient more often.
What does that look like in the home? Well, this is a snapshot of what Nexus is in the home. We go through assessments. So when we go out and see a patient, we're doing initial assessments, and then on an ongoing basis, we're doing assessments. But it's so much more than assessments. It's about managing the plan of care. And so we see in this example in that middle screen there that we have a plan of care. We have badges that the patient can earn over time working with the RT. But it's all about trying to keep that patient moving forward. So there's never a lapse in what we're doing. So if I'm a therapist that's going out to see a patient for the first time, for the 20th time, or if I'm covering for another respiratory therapist, I always know how to keep progress moving forward. And then we have things like our inbox, which allow us to catch problems. So when we see a patient who has an issue, their oxygen level is low, they can't afford their medication, something like that, then the inbox triggers us to do something about it, to make contact with you, or to take the next step to try to solve that problem. So it's a systematic process so that we're doing so much more than just assessments, but managing patient outcomes, managing patient care, and again, being that extension of your services and your practice into the home. The software is driven by competency badges. Again, it's all about patient engagement. How do we create a dynamic dialogue between the patient and the RT? And the software really drives that process. So we can create engagement, but also gamify the process so that the patients are earning these badges with the RT over time. It's not something that we're giving to the patient on an app or something for them to do on their own, but it's really a joint process where the RT and the patient are working together. The patient can't earn a badge without the RT, and the RT can't earn a badge without the patient. And the way that works is each badge is made up of a series of goals. And so in this example, we see the medication badge. We are 70% complete to that medication badge. And so we've completed 70% of the goals. Once we get to 100%, we've accomplished that badge. And now the patient has really graduated from that part of the program, and we move on to something else. Here are the badges: medication best practice, breathing, activity, and self-management. It's really about systematically solving problems for respiratory patients that cause them to go back to the hospital. And if we solve these problems, then we know that we can reduce readmissions, but more importantly, we can improve their quality of life. For an example of that, medication best practice badge is focused on making sure the patient's on the right medication for their stage of disease, making sure they know how to use it, and making sure that they understand the purpose of that medication. The breathing badge is about symptom management. So we're looking at dyspnea scores and CAT assessments, which is a COPD assessment test. We're focused on how do we manage how they feel. We know if somebody feels bad, they're going to go back to the hospital no matter what their vital signs say. So it's really about how do we focus on what they feel, what's affecting them the most, what's causing them the most disability, and then how do we address those problems. Activity is about oxygen titration. We find that 60 to 70% of patients in the home don't have the appropriate oxygen prescription. And so we, on a regular basis, are going to walk the 4 points of the home with them and retitrate their oxygen, give that feedback back to you so that you know that your patient is well oxygenated and they're able to stay active. Self-management part of the program is really about education. It's about educating the patient about their disease process, smoking cessation, nutrition, exercise, all those subjects that matter to their care. It's also about teaching them what to do in case of emergency, which means we teach them how to use an action plan so they know when they get to a yellow or a red zone. We teach them what the CAT assessment is and what their symptoms mean. So the goal is not to say, hey, we're going to keep you home when you're short of breath longer, but it's to say, how do we help you to understand that 5 days before your shortness of breath, you had some symptoms that we could have addressed. You had a headache. You couldn't sleep at night. And so when those symptoms come, they mean something. And if you get us involved at that point, then we've got 4 or 5 days to intervene, get you to see your physician, get some antibiotics or some steroids, and be able to solve that problem before it ends up being a hospitalization or a full-blown exacerbation. So let's bring that all together in software. This is what it looks like in software. We see Martha Smith. When I log into Nexus, I'm going to be able to see right away that Martha Smith is a stage 3 COPD patient. She's a category D, which means she's high risk to go back to the hospital. I'm going to see right away that she's accomplished 3 out of the 4 badges, and I see that because those are colored in over in the top right. So that means if I'm managing Martha Smith, if I manage her on a regular basis, or if I'm an RT that's covering for Amanda, when I go in the home, I know exactly where Martha Smith is. I know where she's at in her disease process. I know how high risk she is. and I know where she's at in the plan of care badges, so I can always work with Martha to take things to the next level. We found in our data that 70% of patients in the home don't have spirometry, which makes it really difficult for us to know what to do next, to know what stage they're in, to know what medications they should be on, and to know how to manage that patient. So spirometry is about trending data for us. It's not to replace what you do. Then the InCheck. The InCheck is an amazing device. It's a device that's grossly underutilized in pulmonary medicine. It's a device where we can check inspiratory flow rates for patients, but more importantly, we're able to check and make sure that they know how to use their inhalers, they're on the right inhalers, and they're strong enough to take their medications. So what this device does is we can set the resistance based on which type of inhaler they have. You can see the different flow rates on the device, so we can set resistance the same as their inhaler. So what this does is we give it to a patient, we set it just like their inhaler, they inhale through it like they would their inhaler, and we can tell if they have the appropriate flow rates to take that medication. What we find most often is patients either aren't strong enough to take their medications, or oftentimes with MDIs, we find that patients take them way too fast, so they get all the side effects and none of the benefits. So this device is, again, gives us the ability to be your eyes and ears in the home, gives us the ability to be able to give you information back to help better manage your patients.
Every patient is also provided this Nexus program workbook you see here by the RT. This workbook has key interventions such as the plan of care, allowing the patient to track their progress towards achieving goals. The example you see here is pursed-lip breathing, but if the patient's having other issues, they can go back to this workbook at any time and find helpful hints to manage their disease process. Now, we do have a RT available 24 hours a day with a response time of 2 hours from the time the patient contacts AeroCare.
This is the program summary. So this is a accumulation of over 20 million data points that are in Nexus Tableau. So what that means is that we can do things, we can summarize what's happening with a patient population in the home and feed data back to you. We can summarize who is the population, look at readmission rates, look at medication management, any of those types of subjects. This is a summary that brings all that together in one place. In this example, we're able to break down readmissions on a monthly basis or on an annual basis. So as we're looking at this patient population, we can see how many admissions do they have before coming in the program, and then how many have they had since they came in the program, and then you can easily see the percent reduction. So we're able to take this back to you guys, take this back to hospital systems, and show them how much we're able to drive down readmission rates. The program summary also summarizes medication management. So as we're looking at medication management, we can see how many patients came into the program who only had a SABA or a rescue medication or didn't have any medications at all. What we find is that about 25% of patients coming into the program only have the rescue med or don't have any meds at all, and most of the patients, as you saw from the previous screen, are stage 3, stage 4 COPD patients, and so they don't have the appropriate meds. What we're able to do with the software is work with you as the provider to be able to solve some of those problems. So what you're seeing in this graphic is really how we've solved that. We've taken that percentage from 25% down to less than 10% in a lot of examples, because we're able to work with you and get the patient on the right medications, be able to work with you to say, hey, this patient has progressed. Maybe we should look at adding some kind of maintenance medication into their therapy. So what's that mean for you? That means that your patients are going to be better managed. Your patients are going to we're going to focus on what matters to keeping them out of the hospital, but more importantly, what matters to keep them home with their family. So across the board, we've seen 75% or more reduction in readmissions in this program. We currently have a 78% compliance rate, which is much higher than the national average. So that's greater than 4 hours a day. So we're talking about patients who are respiratory failure, on ventilation devices, and we have a 78% compliance rate. And that last number you see there, 86% of patients are stable or improving on their COPD assessment test. What does that mean? That means that we've been able to teach patients how to manage their own disease, how to self-manage, to a point that the majority of patients in the program have gotten to the point that they know what to do when an emergency comes. They know what to do when a situation arises, when an exacerbation arises. So really it's about how are we managing your patient population? What have we done for them? And what can we do for you if you partner with us today?
Thank you so much for your time. We look forward to partnering with you and taking your patient's care to the next level.